Hi, this is Aimee
and Melissa. We are a couple of retired Texas teachers who are CALTs, Certified Academic Language Therapists. We started our own businesses, and now we have a podcast called The Dyslexia Duo.
So join us for our informative podcast, where we'll delve into dyslexia, covering the topics that affect parents, therapists, teachers, practitioners, and anyone who wants to learn more. We'll guide you through everything you need to know, from the first signs to the intricacies of dyslexia curriculum placement and beyond.
This season, we will cover the referral process, what to expect when your child or student is dyslexic, the generational impacts of dyslexia, and how to support those affected.
Come join us. Melissa.
Hey, Aimee.
So we just finished up this section with Margie Gillis. And if you don't know who she is, y'all, you should know who she is. She's kind of a big deal. So on her bio, that I'm just going to read the first paragraph, she's a recognized CALT. So those of us in the biz, we know what that means, who has been teaching children to read for over 40 years. She has a doctorate from the University of Louisville in special education, and she founded Literacy How, which provides professional development opportunities and coaching for teachers. And she talked an awful lot about professional development, how our teachers aren't getting it at the college level, how we still need that professional development while teachers are teaching children. They're not getting what they need.
Right. It was so interesting how she has family members who also are dyslexic. So she was very familiar with dyslexia, both professionally and personally, and even her family members. Some of them had a difficult time getting identified. I also thought it was so cute when she talked about her younger sibling who was not going to school yet, but she taught her younger sibling how to read as she was going through school. And I thought that was so cute because I actually played school as a little kid too, but I was the youngest of 5 girls.
Oh, yeah.
And nobody wanted to play with
school
me.
with you.
So I was the student and the teacher. So that was interesting.
We had enough school to last a lifetime in my house because my mom was a teacher and we had 3 girls. And so we had a chalkboard in the garage, but we didn't write anything on it. We just drew pictures on it. But, you know, we had enough school to last us a lifetime. But
here you are.
All that, here we are. But y'all, this is a great episode. And so join us to hear Dr. Gillis's interview.
Thank you.
Thank you.
Hi, this is Melissa.
And Aimee, and we're the
Dyslexia Duo.
So today we have Dr. Margie Gillis. And you kind of came onto my forefront, Dr. Gillis. I think I went to an ALTA or IDA seminar some years ago, and I went to your breakout session, and I was like, oh my gosh, she's so knowledgeable. And I've just kind of followed, and I want to say this was like 7 or so years ago.
Oh, wow.
Yeah. And I've just kind of followed you ever since. I own a couple of your books.
Nice.
Yeah, I use your video for training from understood.org when I work with parents, when I work with new teachers in the area. So go ahead and introduce yourself.
Yeah. So call me Margie, please. And Margie Gillis. And I am the founder and president of Literacy How, a nonprofit organization in Connecticut. And we provide coaching support for teachers, all ages, pre-K teachers, all the way up through high school. And we really believe that the coaching support that teachers receive is the difference maker when it comes to transferring the knowledge to practice. And isn't that what we're after, right? We want the practice. We want the teachers to feel confident that what they're doing with their students is based on research and evidence, but it's not easy to make that transfer, and you really do need a lot of support to make that happen.
Absolutely. Now, did I hear that you're a CALT also?
I am.
Where did you receive your training?
So I was very fortunate to receive my training in Dallas
Oh.
with Aimee Cox.
Oh my goodness.
I know.
Wow.
So did you go through with Mimi by chance?
No, not
Okay.
with Mimi. I went through the program I started it in 1986, the year my third child was born. And we were living in Dallas at the time. I had been in a master's program years before that. Like I graduated in 1975, and the woman who was the director of the program at the University of Connecticut told me about alphabetic phonics. I'd never heard of it. And I was going to take my first position as a special education teacher in Maine. And I said to her, Dr. Lieberman, I need to know how to teach this content. Like, she was a researcher. She taught me about phonemic awareness long before it became a buzzword. But she said, oh yeah, there's a woman in Dallas. Her name is Aimee Cox. She developed a program. I said to her, Dr. Lieberman, do you know I'm going to Maine, and Maine and Texas are pretty far apart. But fate is a funny thing. I met my husband that year, or I re-met him. And the year that I moved to Maine, he was living in Austin at the time, but he got transferred to Fort Worth. And that was the perfect time. Timing is everything, right?
Right.
That was the perfect time for me to study a different methodology, which I had heard about, but I'd never engaged in. And that was an opportunity for me to practice what now is called structured literacy, but to practice that with individuals, an individual pilot student that I had at the time. And I learned so much through that process, and that's really carried me forward. And I've taken pieces of that into the work that I have done in the last 25 years with teachers.
Very nice. Melissa and I are both Calts, and she got her Calt at SMU, and I got my QI at SMU. And
oh, wonderful.
Thank you. And one of the training cohorts that I do for therapy is a hybrid of alphabetic phonics and MTA, because I want my trainees to see the historical roots as to why they're saying what they're saying. So
fantastic.
Well, the foundations of literacy really is such a key component to getting started for anybody who's needing to get that instruction and understand why we do the things we do. I believe in that. But in that book, I really understand it a lot better when I looked at that book and really dissected it.
For sure. Very, very important.
Okay. So you talked a little bit about your career, and could you tell us a little bit about your motivation as to why you do what you do?
Sure. My origin story.
Yes.
But it's funny. It's an interesting story, because my mom always said that I was a born teacher. I was the fifth of six children. I had a little sister who cried when I went off to kindergarten. And so for Christmas that year, my mom got us little desks, and we played school every day. Oh. And she went to school 2 years later, basically reading, because I taught her all the things that I was being taught. And I went to Catholic school. The nuns taught us letters and sounds. We still learned to read with Dick and Jane. I didn't have any trouble learning to read, but my older brother, had a lot of trouble learning to read. And the little bit of phonics that he was taught wasn't sufficient, because he was learning, the old whole word method, which then became whole language, which then became balanced literacy. Mm-hmm. And that didn't work for him, because as it turned out, he was dyslexic. We didn't know it at the time. We didn't diagnose or identify dyslexia back then. And I'm sure my dad was dyslexic, because we know it's runs in families, it's hereditary. Interestingly, my husband is dyslexic. We have a daughter who's dyslexic, and we have 3 granddaughters. 2 of the 3 have been identified with dyslexia. So it is really personal for me, as well as part of a professional journey that I really didn't quite understand at the time, but I was drawn to this field because I knew there were lots of people who had trouble reading, and I had no trouble, and I loved reading, and I felt really sorry for the people that couldn't do it and wanted to do it so desperately that I just was on a path to understand more about it.
Yeah, it's interesting how life just put you where you needed to be so that you could help those along the way who you needed to help.
It's so true. It's very
wonderful,
true.
Wonderful story.
It made me think that with all your knowledge, probably your daughter's teachers or your grandchildren's teachers are like, oh no, she's coming because they're going to identify the kids with dyslexia. We better make sure that we're providing what those kids need because, Dr. Gillis's grandkids and daughter and all that. That's how I would think.
Ever. Not so much, but we figured it out. But if they were in the granddaughters were in a public school. And I have to say, in all my years of being in education, and especially special education, where I would go to what we call PPT meetings. I know they're called different things in different states, but people planning meeting where you're hashing out the data and figuring out if the student qualifies, and oftentimes fighting to get services. And I've been at some pretty tough meetings, but I have to say the one for my oldest granddaughter was one of the hardest, not just because it was a personal, gut wrenching that they didn't want to provide the services, but because there was such an incredible rejection of the science. And a psychologist, a school psychologist who knew nothing about phonological processing, who knew very little about reading disabilities and how to assess. I mean, it was shocking. And it was in a pretty affluent district in the Northeast. Obviously will not name it, but I was shocked. I really was. In 2022, I think was the year.
Oh, wow.
So just years ago.
Oh, wow.
And consequently, my daughter just pulled the kids out of the public school and found a private school for them to attend. Not a private school for kids with LD, but they do have a school within that school. And they're doing a great job of working with kids that have reading difficulties, including dyslexia. Wow.
So I'm curious now, if you could go back and give a definition of dyslexia to that team, what did you tell them that dyslexia was or is?
Well, I always start with the fact that it's neurobiological, because I think it's very important to explain that it is, based in the brain. It is something you're born with, right? It's hereditary, and that's very, very important. We know so much now about the genetics of dyslexia. And if we know that, then we have to flag kids who have histories, whether it's their parents, their grandparents, an aunt, an uncle, whoever, because that we know about. Like when the child is born, they know what their history is. And so the history is really important to mention. Certainly that fact that it's based on not 100%, but in large part on processing language, right? It's a language-based learning disability that includes processing phonological information, and that there are secondary consequences that can impact certainly comprehension, vocabulary, all sorts of other things that happen because you're not reading, and therefore you're not building background knowledge. You're not necessarily growing your vocabulary unless you're getting read to on a regular basis. So it's complex. I would also say, and I know this is a long-winded answer, I also think that it's important to mention that dyslexia is it's generally not just this, right? You are dyslexic and. So we talk a lot about, to use the vernacular, comorbidity, but it just simply means co-occurring. That dyslexia co-occurs in many cases with something else. It could be more than one something else. It could be attention and difficulties with executive function, which have overlapping characteristics. Anxiety is something that often happens in concert with dyslexia. Certainly, dysgraphia is also something we need to be aware of. It's different, but it can co-occur with dyslexia. Dyscalculia, so difficulty with math. The list, I mean, depression. There's so many things that contribute to why dyslexia is complicated, and treating it can be complicated because there's so many different pieces to the puzzle.
Absolutely. It's such a spectrum disorder, and I'm a dyslexia teacher, dyslexia therapist, and then QI, and I was in public ed for 30 years, and 27 of it was in dyslexia. And very seldom did I see two students that progressed the same way or had difficulties or the same degree of difficulty, even within families. What they were demonstrating was so different from the other person. And so, and I did evaluations for years and years and years too. And you can't just rest your hat on what you've done in the past. You have to look at everything. It's like putting together a puzzle every time you do an evaluation.
For sure.
I also find it interesting when I think about my students who I've had in the past too, the way that they present with dyslexia and how they progress, kind of like what Aimee was saying. There's different levels of their emotional needs that you have to support along the way. So a lot of times they come in and you can't even get started right away on the therapy because their emotional needs are so great. You kind of have to kind of remediate some of the emotional impact from the dyslexia and how that's affecting them, and kind of just really build a strong relationship before you can really get them to trust you, to open up, to learn what they need to learn, is what I've experienced in my past as well.
That's a really important point, Melissa, and something I think most of us who've worked with individuals with dyslexia have found to be the case, because they inadvertently start to feel bad about themselves as humans, and they don't even necessarily feel like they have strengths, even though many of them do. Mm-hmm. They don't necessarily feel that or see that play out. And so it is really important that they find teachers, plural, ideally, that understand what their needs are, as you say, socially, emotionally, and otherwise. Incredibly important because it complements the hard work that they're doing academically to succeed.
I feel like that's a strength of Melissa's too.
Oh, well, thank you, Aimee. Thank you. I think it helps when I struggled myself, not with reading, but I struggled myself with math. And I think I can kind of put myself where they are, not in all aspects, but I can understand the struggles and how it felt in school and how that really makes you feel like you're less of a person. When you, especially with reading being everywhere, you can kind of understand how the kids can feel like they're the only ones that can't do this and everybody else can. And they just really start internalizing it at a very early age.
For sure. It's incredible how early they pick up on it. They are so intuitive. And that's why I think it's so important that we find these kids as early as possible. I know that's something you're planning to talk about today or ask me about today. Very, very important.
I loved that you said getting that family history as a huge component too, because that if we know already that there's family history, that should be something that we can identify early on in kindergarten, that the parents should have to report right away. So we know kind of what we're dealing with as soon as kids come into the school.
Yeah, for sure. And I think the concern on the school's part is that we're going to look for something that may not be there. And why would you set a kid up for being identified if they're not at risk? And so why would you ask that question? But it's like a medical diagnosis. If you have a family history of diabetes or heart disease or cancer, like, you need to know that, because that gives us a better chance at finding those difficulties potential difficulties and just being aware that they may surface at some point in time.
Very good point.
We're talking about instructional programs and instructional approaches. And I have a lot of teachers, I have a lot of parents that come up to me and they'll say, oh, is whatever dyslexia curriculum OG? Or how can I learn OG? It's hard to explain to some people, well, one's a curriculum and one is an approach. So can you talk about the difference between an instructional program and an instructional approach?
Sure. This is such an important question, and I understand why it's confusing for anyone, a teacher and a parent, to really sort it out. And the way I like to explain it is an instructional program is what is referred to in research as a standard treatment protocol. So if we're thinking about figuring out what works for a specific child or a group of children who have a profile, and we want to know what intervention is the best program for that profile for those students, we can think about what's called standard treatment. Like, this is what the profile is, and these students, based on research, need these components of a program, and the program needs to be delivered this way. So we talk about fidelity, right? When you're delivering a program, if you want to know if the program is working, you have to deliver it the way it was written to be delivered. And there's usually a scope and sequence that you follow, and you don't deviate. And many of these programs do have a specific scope and sequence. And then the teacher doesn't have to make countless decisions about, do I skip this next step or do I reteach that step? Those are all good practices in general that we think about when we think about an approach. But when we're thinking about a program, you don't skip steps, you go in a specific order. And then when the student succeeds or doesn't succeed, you can say, well, I followed the program with fidelity. So it's not the program that is the problem. It's not the right, well, it may not be the right program for the student, right? So you figure that out too, like it doesn't fit the student's profile, but you followed it with fidelity. And there's lots of programs out there. I often say one size doesn't fit all, because one program very rarely works for every student with varying profiles of learning. When you think about dyslexia, it generally impacts the word recognition skills, right? So you would want a program that addresses decoding and encoding and spelling versus a comprehension focused program that might be better suited for a student that has language comprehension difficulties. But having said that, we also mentioned earlier that there's no classic dyslexia, right? So in general, you have profiles that might have a greater need on some, I think of Hollis Scarborough's rope, like some of those strands more than others. And in that case, an approach, what I call a problem-solving approach, meaning I'm going to use data to figure out where the student's difficulties lie. I am going to identify, right, what the problem is. I'm going to use a problem-solving approach, which means I can flex it depending on how the student is responding to the instruction. I can pull things from other programs, right, to help teach that content. And along the way, I'm going to monitor the student's progress so that I can adjust the program accordingly. So it's an approach is all about keeping the problem at the center and deciding as you're in the moment, diagnostically and prescriptively figuring out what I need to choose to teach a skill that seems to be weak for that student, something that student needs more practice on. So for example, Orton-Gillingham and alphabetic phonics are approaches. They're not scripted. Yes, they have a scope and sequence. That doesn't preclude you from having a scope and sequence. That's good practice. But it could also mean that as the student is going along in that approach, they could accelerate if they don't need as much intensity in certain steps of that program. And again, it's using data really even more, I think, strategically and carefully to guide what changes need to be made along the way.
I do in my training groups that I have when I'm training to therapists, I caution, because we are training in that hybrid and it is the approach. But while you're in training and you're using a program to inform your decisions, not to deviate, especially the first couple of years, because you're not quite sure how everything's going to work together, basically. And so I really tell them, don't deviate from fidelity. And we talk about what fidelity for the various curricula that I train in. And then we talk a little bit about integrity. When you're a therapist, there's some things that you can change, but not for everybody, right? Like if there's a fluency piece that's added in, but you want to try a different fluency piece that's not included in that curricula, I wouldn't do it with all. I might do it with one or two who need that piece and being prescriptive, basically, like we talk about quite often.
Yeah, I think that's a good point, Aimee. And I agree with you that when you're learning something for the first time, and even more than one time, right, that going through a more scripted program, or as you refer to it, a curriculum, is easier. First of all, it's easier to follow. It's easier to spend time observing how the students are reacting to that and how they're actually acquiring those skills. And the more experiences you have with different students who go at a different pace or have more or less challenges with different aspects of learning, then you can start to deviate, as you said, from the program. But I think it's really important to learn a program first, and it helps develop confidence. It helps build your repertoire of different types of learners who do need different aspects of the program weighted differently, depending.
Right. I will have to say, I have many trainee, they go, when did you feel confident into what changes you can make? And I'm like, sister, I'm still, there's times where I'm not really sure. I'll have a student that throws me a curveball and I'm pulling all my resources trying to figure out what can I do? How can I help this student? So, but, I didn't start to feel confident in a curriculum until I was like 3 years into it, where I felt like I could make some of those judgment decisions.
Yep, for sure. The more experience, the better.
Mm-hmm.
What is the difference between structured literacy and a multisensory dyslexia curriculum?
I think the way I like to explain it is structured literacy is a brand that IDA coined, a term that IDA coined, sort of to explain that in order to teach students the complexity of the English language, right, to build proficiency with reading and writing English, that it has to be informed by the structure of language. So the structure of language are all those elements of language that we know about: phonology, orthography, morphology, right? All those elements that are part of the content. Okay, so structured literacy is content focused, and then it has the how. Like, not only is it the what do we teach, like I just explained, and phonology, we teach phonemic awareness and phonics, and orthography, we teach how words are spelled. And so all of those elements of language that I just mentioned, but it's not just that, it's how do we deliver that content? And so I refer to that as the pedagogy of instruction. And so there are pedagogical principles that are just good principles of how you teach, whether you're teaching math or music or anything, right? We want to be explicit when we're teaching, especially new learning. We want to be systematic. So that means we have a scope and sequence. We want to be data-driven. We talk about multisensory. I use the term multimodal, but they're very similar. So we're going to use all the senses, and we're going to make sure that the student is using their eyes, using their ears, using their mouth motorically for pronouncing the sounds, for example, using their hands for handwriting, all of that multimodal instruction is a pedagogical principle, again, for teaching and engaging students interactively. So I think they're both really important. When I talk about structured literacy, depending on my audience, if I'm talking about general ed students, structured literacy is going to look different than if I'm talking to special education teachers and I want them to have deeper knowledge of that content. And I also want them to understand the pedagogy, because students that have reading difficulties are going to need instruction that adheres to those pedagogical principles even more so.
That makes sense. So then a follow-up question to that. So what are the important components that should be included in all dyslexia curricula?
Having the content specified. So all of those elements that I just mentioned, even thinking about syntax, for example. I talk a lot about syntax, and you think, well, sentence structure for students who have good language comprehension, you may not need explicit instruction in that. And yet we know that a lot of our kids with dyslexia struggle with writing, and writing, a very important step in explicit writing instruction, is teaching kids how to construct sentences, understanding how a phrase works in a sentence versus a clause, how conjunctions are used. So I think all of those elements that I mentioned before, that content and the elements of language that I mentioned, are really important in any dyslexia curriculum, along with the pedagogical principles that I also mentioned.
Okay.
And then something that we really have to think about is motivation. So there is a science of teaching reading, but then there is also the art of teaching. That sounds like, Melissa, you're really good at connecting with your students, right? That you can have all that knowledge and know the content, know the structures, but if you don't know how to deliver that to a student who is lacking motivation or has anxiety about learning or whatever the case may be, I think that's also a piece of the curriculum that has to be acknowledged, especially if you're working with older students. And so there are a lot of aspects to that curriculum, I think, that we have to factor in.
That's a wonderful response. Thank you so much for clearing that up for me and for our listeners, because I know we've had a couple of questions about this recently, Aimee.
Yeah, we have. One of the things I see when I go into districts and I do training, I'll hear, in the state of Texas, we have something called reading academies, and it's, the science of reading, but it's very broad, right? It's talking about phonology and decoding. It's talking about the big five. And we also have some teachers that are OG trained, and there might be some teachers that are even letters trained. But one thing I'm seeing is that they receive all this great training, and then they go back to their classrooms and they don't know exactly what to do with it. How can we support those teachers? What can we do to help those teachers understand? I mean, we can't be in their classroom 24/7, but what could we do to support them?
Well, I think partly the answer to that depends on what role they're serving. So yes, you mentioned letters, and letters is pervasively used to train teachers in all tiers.
Yeah.
And clearly a teacher who's working in general education ideally should know all of it, but is not going to be expected to work with students that have the most, severe learning challenges. That knowledge and that practical experience really is critically important for example, reading interventionists, special education teachers who are working all day long with those students. But that said, the work that we do at Literacy How is really about coaching teachers. And we can't do the practicum that you just mentioned, Aimee. Like, that would be ideal. Every teacher, I always say this, if you have an opportunity to work with a student one-on-one and have a supervised practicum of sorts, it's worth every minute. because that's where you really understand how to differentiate instruction based on the needs of your students. But that's not a practical solution to the problem. I think what does need to happen is that the teachers need to have a coach who knows reading, who's worked with kids of different difficulties, who has good people skills, who knows how adult learners learn. So, our coaching involves what we call cognitive coaching, where we basically get teachers to reflect on what they're doing. It's data driven. So Jan Hasbrook, who I'm sure you know the name, co-wrote Student Focused Coaching with Daryl Mickle. And that approach to coaching is really about having the data, the students' data, drive the coaching process. So instead of a teacher feeling like you're criticizing my instruction, it takes a little bit of the onus off the teacher and it puts it on, this is the students' data that we're looking at here. Yes, you could say, well, the teacher could say, but I'm the teacher and I haven't been successful teaching this student. That's true, but we're going to look objectively at what we're seeing here. And then we're going to decide, where do we want to go? Like, how do we want to prioritize the difficulties the student's having? So coaching support is really important. I also think that this is 25 years of working with school districts and learning firsthand that teachers get very little professional development that actually matters. They might have 2 or 3 days a year. Oftentimes it's a one size fits all. So on election day, everybody goes into an auditorium. They all learn whatever the topic is of the day. And it's not differentiated to meet their needs. So we have to provide professional development that is actually going to transfer, as I said earlier, to the students' ability to learn the content. And that just takes time. So again, I don't see it happening enough. And I don't know what the answer to the problem is, other than to impress upon the teachers, rather the administrators, because they make the decision, how important it is that teachers get the professional development. And parents oftentimes can exert some pressure on the administrators. And yeah, it's a problem that we see over and over again. And it comes down to money, and money is often the driver, because it just requires extra revenue to pull teachers out of classes to do that professional learning that is so important.
That is a big concern I see going from private practice to districts, that the admin will say, how many days do you need? I'm like, well, this is pretty deep. I need a lot of time. And they were like, can you not do this in 4 days instead of 5? No. Tried.
Exactly. There's a lot of learning that needs to happen. Mm-hmm. And of course, ideally, we would like the teacher prep programs to have done that.
Right. We're still noticing out here, because where I'm based, I'm really about 20 minutes away from 2 pretty big universities. And, one university, I don't know what they're doing any longer, but the other one is the hub for reading recovery still. And I'm like, good Lord, we're still doing that.
Oh my goodness.
Right.
Oh my goodness.
Right. It's super surprising to me. And I totally agree, with the whole professional development. Up until I can remember just 7 years ago, doing a professional development when I was a therapist on a campus, and they had the right idea. They gave us the state assessment data, and we broke that data apart and looked at where the students were weak, and then we did nothing with it. Mm-hmm. And I'm like, well, we have all this great information. How are we going to support our students? We didn't do anything with it, which is kind of a time filler, in my opinion.
Or ask us to look at the data of the children who are falling behind and ask our input, and then they don't listen to our input when we are saying, oh, well, why don't we look at this kid for dyslexia, where they're showing the characteristics. They've got the word recognition difficulties, the spelling difficulties. Why not? Let's let's take a look. No, let's wait until second grade. Really?
No, you're kicking the can down the road,
Yeah.
as they say.
Why waste their time? Why waste the child's time? Okay, so I have another question for you. I run into this a lot in the public school, or I did run into this a lot in the public school. Response to intervention, RTI, would sometimes block the actual assessment that needed to happen for kids. That my administrators would say things like, well, they need to be in RTI for about 8 weeks before we will consider testing them and see if they really make progress. And then when they do make some progress, because they're getting some, quality instruction from a small group, 1-on-1 or 1-on-2 or 3, they do make some progress. Well, they're making progress, but they're still not where they should be able to be, based on all of their other data. So can you talk to me a little bit more about RTI and your thoughts on that?
I have a long history with it because I was at Haskins Laboratories in 2000, which is a research lab in New Haven. And it was just before I joined. So maybe it was like 1998. And some of the researchers who were doing research on RTI, including the Fuchses at Vanderbilt and others, were writing about this idea that kids would be assessed, right? All students would be assessed using a universal screener, and that based on those data, they would, if they didn't pass the screener, they would go into another tier of instruction, and they would get a more differentiated, focused intervention based on their needs. And if that didn't work, they'd go on to the next tier. And at that point in time, I would say the vast majority of the country was using a discrepancy model for finding kids that weren't making adequate progress so that they could receive specialized instruction and, be identified. We know that doesn't work. We know that discrepancy formula has been dismissed as a valid way of finding kids who need specialized instruction. So I was very heartened to read about RTI and think about, well, this is a great system for getting kids in and out of increasingly targeted intervention and instruction. And ultimately, the child who wasn't making progress, who wasn't responding to instruction, would be identified and receive the instruction in addition to tier 1. So there were lots of misconceptions about RTI in the early years, but conceptually it made a lot of sense to me. Mm-hmm. And so it's a framework really for getting kids what they need. I think that what was missing from RTI and is still missing, it's, as you said, Melissa, it's still a wait to fail model. And that's really what, before RTI was on the scene, that's what was happening. Kids had to fail because they had to have a discrepancy of 2 years or greater, which means that they had to be at least in second or third grade before they would qualify for services. And we know that prevention, early intervention makes all the difference in the world. So right. It completely discounted what we know about finding kids early and giving them good instruction before they get further and further behind. We still have RTI that's a wait and fail model. Exactly what you said, Melissa, that we're still saying a kid has to be in intervention for at least whatever it may be. A lot of times it's 12 weeks, but 12 weeks turns into 18 weeks, turns into 24 weeks. And before you know it, the better part of a year has passed and a child still isn't getting the instruction they need because they don't feel like they've had enough time to determine if it's been an effective intervention or not. So by all counts, we're still not using the framework the way it was designed to be used. Another thing that we see is the kids get an intervention, but they're getting pulled out of tier 1 and they're not receiving the content that they should be getting in their general ed classrooms. There's all sorts of problems with it. I think multi-tier systems of support is a more comprehensive approach because it acknowledges the systems more so than the framework. RTA is part of MTSS, but MTSS is much more than just those tiers of support. It acknowledges that there has to be a well-oiled machine that includes a data process that is adhered to, looking at those assessments on a regular basis, including monitoring progress according to a timeline, again, that's adhered to. Like there's the social emotional needs, behavioral needs are also acknowledged in addition to the academic needs. That's also a big part of MTSS. So I think the problem with it is it's easy to describe it-ish, easy-ish. It's not that easy, but once you understand the concept, you can say, okay, these are the systems that have to be in place. I can tell you from working with schools now for 25 years in Connecticut, it is rare that you see a school district that has it figured out and has it managed so that everyone in a school knows that this is the expectation for what assessments are going to be used, what the process is going to be, and making sure that a child doesn't get stuck. And that's how it feels, I'm sure, for that child and the family, gets stuck in a tier that is not working for that student. It's hard to do and pull off these systems and structures well.
I agree. And it leads to frustration amongst all parties.
It really, really does. And because again, it requires personnel who are trained, who are well trained to oversee the systems. And then that includes training teachers. It includes building in time for teachers to look at data. And my experience with teachers is they give the assessments, but they're not trained to analyze them. They're not trained to, okay, now we've done the analysis. We have to put the kids into groups based on the analysis of the data. And that takes time. And also it takes, experience and knowledge on the teacher's part. And then if you really pay attention to the data and you administer progress monitoring assessments, you may have to adjust groups on a fairly frequent basis. That's another time-consuming endeavor. In the end, it sounds good. It's really hard to execute.
I agree with that. We talk about analyzing the data. We do screeners in Texas and into kindergarten midway through first grade, all means all. And still to this day, I'm talking to teachers about don't just look at what the number reports because it's computerized. Don't just look at the number and look for the green, yellow, or red, Look at qualitative, what was happening while the child was doing the assessment. Did they change their answer multiple times? Did they just click, click, click? Did they really think it through? Did they time out and that's why it's wrong? I mean, there's so many things, and we have to train teachers on all of those pieces on how to do it.
For sure.
Yeah.
Yeah. I'm glad you mentioned that, Aimee, because the quantitative data is really, really important, and it's easier to look at reliability and validity, obviously, when you have those numbers. But there's kids that fall through the cracks that we aren't paying attention to their behavior, like you said, their qualitative information that sheds light on why their numbers are what they are. And without that information, it's hard to know the best path to take for those students. You have to look at the big picture, really.
And now a word from our sponsor.
Hey, Melissa.
Hey, Aimee.
So let's talk about who we met at IDA, Tumbleweed.
Oh, I love Tumbleweed's decodable books, and they're for striving readers in grades 2 through 6. My favorite thing about them, in addition to the storylines, is the inclusion of comprehension, spelling, and vocabulary activities.
Yes, and there's no guessing because they took out the visual distractions. They still have illustrations, but not right next to the print.
And Tumbleweed is easy to implement with any core or intervention program. Their teacher guides are jam-packed with multimodal approaches.
Check them out at tumbleweedpublishing.com. Hi, this is Aimee Rodenroth. And as part of the Dyslexia Duo podcast team and owner of Discovery Dyslexia Services, I want to talk to you about my business. Our COUT-trained team offers expert virtual or in-person therapy located in Prosper, Texas, using proven dyslexia curricula like Take Flight, Build, MTA, alphabetic phonics, and reading by design. We also provide crucial independent evaluations and advocacy services. Don't wait. Empower your child today. Visit www.discovereed.com to learn more. That again is www.dyscoveread.com. Discovereed, covering all your dyslexia needs. Let's return to the show.
So, kind of going back to a few years ago when COVID came around and kids were doing their work at home either via Zoom or Seesaw. And then slowly, like in Texas, slowly they started bringing some kids back. They brought the option of you can attend in person or you can attend virtually. Attendance via Zoom and Seesaw and in person was really hit or miss at best. And then when we started bringing all students back in, there's definite learning loss, and it made it really, really difficult to, is this what's happening here? Is it because of COVID, or is this truly a dyslexic student? Do you think at this point in the game, now that we're a few years out from everybody being home and doing work at home, do you think we can still blame COVID measures for learning, saying, oh, they're just not there yet because of COVID? Because I still hear that from time to time. Oh, they were one of those groups of kids that was home during that important time during COVID. And I'm like, well, can we still blame COVID or not? I'm not the expert in this field, so.
I'm not sure I'm the expert, but I guess what I would say to that question is, yes, we certainly can blame COVID for some of the learning loss. And as we know with learning loss, it's hard to get it back, right? We know that when a student gets behind, the only way that you accelerate their learning is to give them more, to increase the intensity and to give them more. So what we should have done is had kids in school, over the summer or extend the school day, right? To make up for the loss, because you're not making that up if you do the same thing you did before. And it impacts the kids who are most vulnerable. The kids that were learning on a decent trajectory probably were able to make up for the loss to a certain extent. But anybody with a vulnerability, whether it's dyslexia or poverty or whatever the case may be, those learning losses are very challenging to address and make up. But having said that, we can look at the data, and we have to keep looking at the data and see where those losses occurred, and then what is it that we can do to close those gaps to the whatever extent we can. I know, you talked about the instruction. Certainly the instruction was not optimum, again, for kids, especially at-risk kids who don't learn well in certain environments, including virtual ones. They need the face-to-face, they need the interactive learning environment, they need more intensity that they weren't getting through a screen. So there's lots of contributing factors. I guess, we have to just acknowledge what those losses mean and meant then and what they continue to mean, and figure out how we can do a better job addressing them. And also identifying the needs of the students, because some of the virtual learning is still happening today. And I feel like we have to do a better job of acknowledging that there are, like I said, kids that don't do well in those circumstances, that need a different type of learning, and which ones need that, and what is it going to look like, so that we learn from our past.
Absolutely. I don't disagree with that at all. And kind of along those same lines, we've heard the dys-teach-ia term before. I mean, that could be a dys-teach-ia piece, but I can remember one year getting a lot of referrals from one teacher because his students weren't making progress according to the boy, moi, oi, assessments they were doing. And somebody, I didn't know what was going on at that campus because I was an outsider. And they said, oh, he's not teaching. It's a lot of dys-teach-ia. Can dys-teach-ia make a student look like they might have dyslexic tendencies?
Yeah, absolutely. Absolutely. I know I did a talk one year at a conference in Louisville, and that was my topic, is it dys-teach-ia or dyslexia? And I talked about the similarities in terms of behaviors that you might see. And at the end of the day, if a child is receiving good instruction and they're attending, right, and they're showing up every day and they're making progress, then the chances are pretty good they're not dyslexic, right? Or they might be mildly dyslexic. But where did RTI come from? Response to intervention or response to instruction came from the notion that if you are dyslexic and you're getting good instruction and you're still not responding, right, the same way that a typically developing child would, then you're struggling, not because the instruction is poor, but because you have a learning challenge that needs to be addressed. And so, yeah, there's going to be some similarities. Like if you have trouble with spelling, I use spelling as an example. Lots of kids can't spell. Spelling is a hallmark skill for a kid with dyslexia, right? My husband can't spell, and he'll never be a good speller. Even though he did get some explicit instruction in spelling. So the difference, right, is that kids who don't learn to spell because they were never taught is a dys-teach-ia thing versus kids who can't spell because they have phonological processing difficulties or they have orthographic, sequencing, orthographic memory difficulties that predispose them to having difficulty with spelling. So the difference is in, instruction, right? And a lot of people will say, well, if a dyslexic person is never going to be a good speller, why bother teaching them? Why do you even teach them spelling? I'm sure you both have heard that countless times.
Yeah.
And then you have to explain the principles of, decoding, orthographic mapping, like all the things we know that contribute to getting a person with dyslexia to be a better reader and in some part a better writer too.
Yes, and the writing is the absolute last part to develop. If they're in a dyslexia curriculum receiving services, if they're not, it's the one thing you still see your adults, that influency, still struggling with in their adult dyslexics for sure. But that's a great answer. Thank you so much.
So if kids are, essentially what you're saying too, is that if kids are taught the way that they need to be taught and they don't have a learning difficulty, they're going to learn what they need to learn. They might be poorer spellers than average, but they are still going to be able to spell if they're taught the instruction. Whereas a dyslexic person is not going to really be able to ever spell correctly for most of their life.
In general, that's the case. Yeah.
Okay. Thank you for clearing that up. So talking about assessments, what's the purpose of a universal screener and why is it necessary?
The whole idea of a universal screener is identifying risk. So it's universal, right? Meaning everybody gets screened, just like everybody goes to the doctor and gets screened for blood pressure, right? Has their blood pressure checked. It's going to show risk. It's not going to explain where the risk is coming from. So it's administered, we like to say 3 times a year, right? Because you don't want to wait in between screening times to find out that the student hasn't met the benchmark, then you're letting precious time go by. So it's really keeping an eye on certain risk factors, and those universal screeners have similar tests that are administered for each grade level, because those tests are going to be indicators of a difficulty down the road for reading, right? So you're screening for reading difficulties, including dyslexia. There's the screeners, again, they don't all have the same components, but for example, we know rapid naming is a indicator. Not all children with dyslexia have naming speed difficulties, but many do. So there's certain things that we're looking for to indicate risk. We're not going to identify dyslexia in a 5-year-old, but we can administer a screener to 5-year-olds and find out pretty quickly which kids are going to, a year from now, have difficulty learning to read because they don't know their letter sound correspondences. They're not naming letters quickly. They don't have phonological awareness. And so these indicators are really important to flag. And when we flag them early, we can adjust instruction, even though we're not saying this kid is dyslexic and they need to be identified. This child has some risk factors. And again, going back to this whole idea of a response to instruction, if we give them really good instruction based on that risk, if they respond right away, that's an indicator that they're probably good. And it flagged them, even though they weren't actually dyslexic. If they don't respond, that's an indicator that we should keep a closer eye on them. And most likely we would want to do some diagnostic assessments for those kids, because now I need to know what exactly is driving that score. You know, again, it could be an artifact of a bad day. So that's again why we want to pay attention to those behaviors that might indicate that. But the diagnostic assessments are really great because those diagnostic assessments are what's going to drive the instruction. And again, for a 5-year-old, a child in kindergarten, if, for example, they don't know their letter sound correspondences, and we know that in kindergarten, we should expect them to be putting the sounds together so they can, you know, blend them and start to decode simple words with closed syllables. If that's the problem and they haven't mastered some of those foundational skills, we can actually shore up those skills. And by doing some very good explicit instruction in a small group, that's where tier 2 could come in, right? Give them a little extra time, a little more practice with those foundational skills. And that's going to set them on a better path for later in the year, and then going into first grade where we know they're going to be expected to do more of that. So it's part of a bigger assessment plan that includes the screeners, the diagnostics, and then, as I mentioned before, monitoring their progress. If I'm teaching letter sound correspondences, I'm not going to wait 6 months to see if my instruction actually worked. I've worked on these, let's say 12 letter sound correspondences. Let's teach them for a couple of weeks. Let's see how much they've learned and move on. And so it's all part of a very well articulated plan for how we're going to get the best result from those kids, especially those kids who are flagged as at risk.
So then how would you recommend sharing that information with the parents, the teachers, the school district, things of that nature?
Well, ideally, you have an assessment platform that slices and dices the data pretty quickly, because a lot of times you give those assessments and the assessment sits in a folder somewhere on the teacher's desk for 2 weeks. And by the time you look at it, and again, no, I'm not pointing fingers, blame, none of that. It's just what happens is the data now is old if you've been teaching some of those skills, right? So I think having an assessment platform where you're getting the data right away and you're getting it at different levels. So aggregated data is important for the district to see. Like I have a district with 12 elementary schools, and I can look at the data at the school level and see, you know, these 2 schools are hitting it out of the park. These schools are modestly performing, and these schools are, you know, in the dirt. Like we need to figure out which schools need the professional development, need the support. And then at the grade level, right? Some grades are stronger than others. And then at the classroom level, so it all has to get disaggregated so that we know exactly where the support needs to occur. And so obviously the disaggregated level by classroom is really, teachers have to look at their data and really see which kids need the intensity and figure out how they're going to get it. Like, the classroom teacher can't be held responsible for doing all of that. They need interventionists can help. And then the kids who are continually getting further and further behind need to be referred for special education. For parents, equally important, I think they need to be kept in the know. And some of the assessment systems I've been working with over the years have a home connect letter that they send to parents. So as soon as those screening, beginning of year, middle of year, end of year assessments have been administered, the letter goes home. It's in parent-friendly language, so the parent knows this is where my student is. One of the platforms has a little running man, that is red, yellow, or green. It's explained what that means. The letter also includes things that parents can do at home. Parents are encouraged to come into classroom conferences with the letter so that the teacher can explain what the letter means. It's sent home in Spanish or, whatever language is spoken at home so that the families know what's going on, even though they may not be able to read or speak English. So the parents need this information very, very, I think, importantly. And again, this all sounds good in theory, but it takes time and it takes an acknowledgement on a school district's part that this should be an expectation so that parents don't find themselves learning at the end of the school year that the kids bombed these assessments and now they're another year behind because they haven't received the instruction they needed.
Yeah, because they need that knowledge. They can also support the child outside of school, get them additional help with outside if they so desire.
And I can think of situations where the parent would receive the information that was talked about and they would come to me, they go, what does this mean? And not understanding the difference between percentage and percentile, right? And they're thinking, yeah, and it's not the same thing. And you try to, sometimes I overanalyze it and I do the bell curve and I show them the bell curve and I'm like, okay, let me just tell you what happens with a percentile. But I think that is so important that we do that. And you kind of addressed, one of our things we were going to talk about is how can data drive the instruction? Data should do nothing but drive instruction, especially if we're going to be prescriptive with what we're doing. I use, like for a dyslexia student, I look at their assessment and I look to see what their weak spots are. If they're taking a really long time to internalize some of the information like phonological awareness, and then they have a deficit in rapid naming and they have a deficit in phonological memory. Well, my goodness. Well, no wonder it's taking so long to internalize and be able to do some of the things that we're instructing them with, for sure. So kind of on that rein with the area of dyslexia, why? I mean, we're still seeing it in Texas and we've had law in place. Everybody keeps hearing me say this in every podcast. We've had Texas dyslexia law in place since 1985, but we still have districts that are not identifying our students with dyslexia. And we know that letter came out from the office, the OSER. What's the OSER stand for?
The Office of Civil
Education.
Thank you. And it said, you should say dyslexia because we'll look at these kids with an SLD and it's all the things are phonological awareness, decoding, fluency, written expression, comprehension, all the things. And they're still saying, they're not saying dyslexia. Why do you think districts aren't saying dyslexia still?
Honestly, it's because if they use the term, they have to deliver the instruction.
Yeah. And it's costly.
And it comes down to money.
Yeah.
It absolutely comes down to money. We didn't use the term dyslexia in Connecticut for many years. And I always pointed to Texas because I remember the story, and I forget the woman's name now. Not Teensy, was it Teensy Miller?
Tynesy
Yes,
Miller.
Tynesy.
Yeah.
Teensy Miller.
Everybody knows her.
Everybody knows her because she was amazing, person, mom, woman, who was determined that she was going to have an impact on other children, right?
Yeah.
Because she saw her child suffer because he wasn't identified. And yet we still, like you said, that was 1985. So almost 40 years ago now.
Yeah.
And how have we let this persist? And it really does boil down to dollars. Certainly a lot of naysayers who still contend that dyslexia doesn't exist. It doesn't help when we have, researchers write the dyslexia paradox and say we shouldn't use the term dyslexia. And I don't think that they meant any harm by doing that. But what often happens is that in our inner circle, we have differences of opinion that get hashed out, sometimes to the detriment of translating this for people that really need to have it translated clearly, like parents, for example, and teachers who are on the front lines. And when you're debating something and you're giving mixed messages, what happens is the teachers throw up their hands and say, you guys can't agree. And so I'm just not even going to deal with this, or whatever happens. And it doesn't help our cause. It actually hurts our cause. Yeah. So there's a lot of contributing factors, a lot of disagreement in the field of dyslexia. Terminology really does matter a lot. So how we define dyslexia, when we talk about causes, that's another thing that people disagree with. There are a lot of contributing factors to that, but I think it really is a money issue.
I think that's exactly right.
Yeah. And if you want to really do right, it is a costly endeavor. But if you did it right in the first place, again, going back to early identification, and just change the instruction accordingly, then it would make it less costly.
Mm-hmm.
Yeah.
And when we think about cost, it shouldn't be about the financial cost. It should be, what's the cost to the child?
The child, the society.
The society, exactly. It's huge.
Mm-hmm.
Another kind of piggybacking on that, and in flip term a little bit, the educators need to know more about dyslexia too. I've had several educator friends who say, I don't really know if this is dyslexia. I see X, Y, and Z. And so I will ask them additional questions and kind of guide them and help them understand it a little bit more. But that's somebody who has a relationship with me, so they felt comfortable talking to me. What about people that don't have that relationship? Or what about people that don't have a dyslexia educator on their campus? Not every school district has that. They have traveling people who come in and just teach in their little classroom, and then they go someplace else. So, I think that's a huge component. The educators need to be taught more about dyslexia too.
I do too. I completely agree that that's a missing piece of the puzzle. And it's interesting when you teach them about it, because we do a lot of professional development with teachers. When you teach them about it, it's so interesting because 90% of the time, they know somebody who's dyslexic, and it clears up some misconceptions that they have when you debunk some of the myths, like it's a visual problem or it's this or that. And then all of a sudden you see the light bulbs go off, and they're so grateful for having learned something that serves them well, not just professionally, but in many cases personally. Like it's an uncle, or it's a cousin, or it's somebody, close to them. And they go, oh, that makes sense now. And that's important. Knowledge is power.
I have every group that I train, there's always at least one person who walks up to me when we finish the initial training, and they'll say, either they self-evaluate, or they say, why wasn't I taught this before? Every time. I have a group that I'm finishing with tomorrow, And I already had one come up to me say, why isn't everybody being taught this way?
Exactly. I remember having the same reaction when I went through the training at Dean,
The Dean Learning Center. Yeah. So what is the best advice you think you could give to a concerned parent or a concerned teacher about, I think my student has dyslexia, or I think my child has dyslexia, or they have dyslexia? What could you tell them?
If they suspect it, I've always said, trust your gut, because 90% of the time the gut is right on target. And especially when we're talking about parents, and it's usually the mom, but not to exclude the dad, but it's, my child is struggling. I went to my kid's conference. The teacher said, oh, don't worry about it. Some kids take longer. The gift of time, it's not a gift of time for a child with dyslexia at all. In fact, it actually compounds the problem. We've talked about that today. So I say, trust your gut. And then I say, just learn as much as you can, because if you end up having to be your child's advocate, if you're looking for somebody else to be that person, sadly, they by and large don't exist. If you can find somebody in the school that knows about dyslexia and become friendly with them and ask them to be the internal person in the building that can advocate for your child. But that's asking a lot, and probably not super realistic. So I think for the parent, for the teacher, it's the same. I mean, unfortunately, teachers are often told they cannot identify dyslexia, even if they know it. They were told by their administrators, we do not use the term. We don't want you to mention it, again, because they don't want to have to pay for it, which is a very sad fact. So teachers feel guilty. I think that's a tough one when it comes down to them putting their job on the line. That's asking a lot for a teacher to take that risk, even though, they feel like it's the right thing to do. So again, I feel like finding other people for teachers, I think finding other people in a building, if you're in a building, public school, let's say, that is not teaching research and evidence-based methodology, I think you find somebody in that school that is studying the content, that knows it, that go to a conference and find your people. If they're not in your school, your district, they're out there, they're in those attending those conferences, the Facebook, what I never learned in college.
Oh, that's a good one. Yeah. That's a great page to be on.
Yeah. A lot of people have learned a lot that way. Attend conferences, like I said, really important, because you just get your energy, and you're like, I feel like I'm on the right track. And then you go to those conferences and you get affirmation, and it keeps you, it keeps you going until you can go to the next conference. I mean, that's what I did for 20 years. Those conferences were my lifeline to knowledge, but also to people who were in the field who could keep me inspired and going.
We're kind of hoping that's the purpose of this podcast for some people, is to once a week get that affirmation, because we drop on Saturdays. So once a week, get that affirmation that, you're on the right track. What you are seeing, this is totally dyslexia. So no, I totally, completely agree.
Okay. So I know you have books of your own. So I would like for you to share the books that you have of your own, but also our listeners like when other people recommend books as well, something that they can grab onto and learn from as well. So could you please share your books?
If you could see my office, like I have so many books, and I read this and I was like, oh boy, how do I even identify? Because I read all that I can, but one of my favorites is Reader Come Home.
Yes.
I'm sure people have mentioned that, by Marianne Wolf.
Yes, that's a really good one.
I love it because for a teacher, I don't know that a parent is necessarily going to read it, but for a teacher who wants to understand the science behind learning to read. And also Marianne is such a prolific and beautiful writer, the way she explains things. I think she also always has a call to action in her books.
Yeah.
And I love the call to action in Reader Come Home, the title itself, why people aren't reading and why it's so important that we inspire everyone to continue to read, because there's something that happens when you actually read a book versus reading something digitally. Why, our devices are just doing more harm than good in so many cases, and why we have to keep those at arm's length, not just from our children, but from ourselves. They're addictive and they're not really helping develop the neurocircuitry that's so important for reading. So I love that book. Another book that is less known, the title is Transform Teaching and Learning Through Talk. It's the Oracy Imperative, and it's written by Amy Gaunt and Ellis Stott. And the Oracy Imperative started in England. That's where it's taken place. We found it years ago through Edutopia, and there's some wonderful videos that you can find. It's now part of Voice 21, I believe. And basically the idea is that classrooms should be alive with conversations and oral language. And that oral language is the foundation of learning to read and write. But there's even more to it than that it's how we express ourselves. It's how we get across our needs, our desires, our opinions. It's how listening is also really important, and it's in such short supply, again, because of devices. So we have really put a big focus on the work that we do with teachers and thinking about what their classrooms should sound like in terms of the language exchange between and among the students as well as the teachers. So again, that would be another great book to recommend. I also love the Reading Comprehension Blueprint by Nancy Hennessy, The Writing Rope by Joan Sedita, certainly Louisa Moat's Speech to Print and the recent revision, all of Louise Spear-Swirling's books, Structured Literacy Intervention. She's written most recently the Structured Literacy Planner. Like I said, I could go on and on. The Ladder of Reading and Writing by Nancy Young and Jan Hasbrook, and I contributed with Nancy a chapter in that book. So there's just a plethora of professional books. And then for parents, there's a couple books on reading. Dan Willingham's book and that I can't remember the title of right now, but it's a goodie talking about the importance of reading. I have it on my shelf. Maybe I can't see it, but anyway, Dan Willingham, it's a book that's written for parents. It might be Raising a Reader. It's something. Anyway, there's some really great books for parents on how they can motivate their children to read and why it's so important for them to do that.
That's great. And I have a few of these books already. In fact, I just ordered the Ladder of Reading and Writing. I just ordered that last night. Go figure.
Yeah. And so what about your books as well?
Yeah, so our books are the Professional Learning Series. There's 4 of them. You held up a couple, Aimee. So there's one on PA and phonics. There's one on vocab, comprehension, and then one on syntax. And each one obviously goes into detail on that particular topic. I think the one that resonates with a lot of teachers, there are 2, the syntax and the comprehension, because while there's a lot written on comprehension, there's not a lot written on syntax. And our approach is very much, what do you do in the classroom? So we give a little bit of background to make sure teachers understand core principles and the research that we know is informing that topic. but it really is, what can you do in your classroom? What are some instructional methods and activities that will teach the content?
Beautiful.
Wonderful.
Yeah, no, it's great. It's absolutely great. And I'll admit to my shortcomings, my shortfalls with my training. I don't feel like I push the comprehension and the vocabulary hard enough. And that's been one of my things that in my head, in fact, I was just writing lectures last night, really pushing morphology and vocabulary and comprehension harder with my trainees so they understand the low-hanging fruits, the phonology, in my opinion, phonology, decoding, and fluency. That's kind of easy for us as therapists. It's that other side of the riding rope that we need to work a little bit more on.
I agree. And comprehension is so obviously complex. You're teaching a process. Whereas with phonemic awareness, phonics, you're teaching to get to a product, like to be able to decode, to identify spelling patterns and so forth. Comprehension is not the same.
No.
It's not a skill like PA and phonics are. So it's building, the knowledge. It's thinking about the process that's required for kids to comprehend. And that just takes more, I think, knowledge on the teacher's part to really understand and be able to deliver.
Absolutely. Well, thank you so much for your time. We spent a lot of time together and we
did.
My notes.
My hand hurts.
So this has been so helpful. Thank you very much.
You're very welcome. It's my pleasure talking to both of you. Thank you for inviting me, and I wish you all the best in your work, and I know you'll have lots of other, people to talk to in the field and help people that want more guidance, right? That's what it's about.
That's kind of the goal.
All about the kids, I like to say.
Absolutely. Absolutely.
And we're grateful for people like you and Jan Hasbrook and Nancy Mather who have talked with us. Thank you for your time. It's very valuable. We appreciate your knowledge.
Oh, you're very welcome.
Thank you.
You all have a great rest of your day, and let me know when this is going to be aired.
Absolutely. I'll send you a link.
All right. Sounds great.
Thank you.
Bye.
Bye-bye.
The Dyslexia Duo podcast hosts are Aimee Rodenroth.
Melissa Dean.
Our producer is Greg Rodenroth.
You can find us on Facebook at The Dyslexia Duo.
Email us any questions or comments at thedyslexiaduo@gmail.com.
Awareness is so important. Share this podcast with your friends,
family,
and teachers.
Thanks for joining us.
Bye.